Rural communities represent 20% of Quebec's population, and while they have not been hit as hard as big cities have by COVID-19, they do not have the same emergency care capacity. In a letter penned to Le Devoir back in March, a group of healthcare professionals sounded the alarm on the situation by calling it a dangerous blind spot. Dr. Richard Fleet is one of the healthcare professionals who co-signed that missive. He's an emergency room physician as well as a professor and research chair of emergency medicine at l'Université Laval in Quebec City. He's been studying rural emergency care for the past decade, and he joins us on the line from Lévis on Quebec City's South Shore. Good afternoon.
Good afternoon. How are you today?
Well, I'm curious to find out what the situation is in rural communities when it comes to emergency care right now.
Well, we've been studying rural emergency departments for a long while, and we know that there are huge discrepancies in terms of access to specialists, to diagnostic equipment, for example, and that when cases get a bit complicated, we're talking small rural emergency departments, we need to transfer patients, and that's over, several kilometers, sometimes hundreds of kilometers, and that puts already pressure on the system. We also know that rural hospitals are staffed, these emergency departments are staffed generally by one doctor, the same doctor, family doctor that takes care of patients in his office, could deliver babies, could do all sorts of other functions. And if they become sick with COVID, there are just not many players on the bench to replace them.
What happens when you add COVID-19 into the mix?
Well, that's what we said. We surveyed all rural emergency department chairs with the collaboration of l'Association des médecins d'urgence du Québec early on in the pandemic. And one of the fears was really to contaminate your family members and actually not have enough doctors or even nurses to take care of the patients. And so if, for example, let's say at L'Hôtel Dieu de Lévis, cases occur, well, we are several doctors. It does put a lot of pressure, but in a small rural place, already people are overworked, and they may not have people to help them come in. Especially, they already rely on médecins dépanneurs to cover emergency shifts. And, these médecins dépanneurs in the pandemic coming from red zones may not be able to enter and help out.
How ready are rural hospitals for a second wave? We were in it. Dr. Horacio Arruda has said it has started. We've now entered a red zone depending on where you are in this province. Some communities have established self-proclaimed a red zone. What do you see going on?
Well, every rural hospital is different, but I think that what we saw from the get-go, being in communication with them, is that they took this very seriously and were very well prepared with the help of their CIS and their CIUSs. But the fact remains that, if you need to put several people on ventilators at the same time, transfer them over distances, or even staff your hospital, you may be facing a challenge. So we need to be very cautious in those rural areas to avoid something like the CHSLD.
You're mentioning their equipment, ventilators. Is that all that's missing, or what else is needed out there?
Well, to be quite honest, already they don't have the full resources. I mean, they can take care of lots of emergencies, stabilize patients, and all of these places. Most of these places have vents, but they would need to transfer a patient on a vent, within a very short while, and then that means you need an ambulance. And we know already that paramedics are hard to come by in rural areas, and ambulances as well. And when you transfer a patient over long distances, well, your area is not covered for other things. So for the rural areas, we're very concerned for all the other things, the collateral damage, the traumas, the heart attacks, the strokes that we already documented important discrepancies in terms of impact in the rural areas. And certainly not because the doctors and the healthcare professionals are not doing a good job. It's just because, the level of resources is just not there in the rural hospitals. So we need to be cautious.
So what does the government need to do?
Well, first of all, I think they need to be very cautious in terms of Should they close the roads? Should they? I know they're doing in Charlevoix. There's over the weekend. They're not closing the roads, but they're making like some sort of a blockades just to make sure you really need to get into the area. What will you be doing? So they need to be very cautious because tourists could, over the next few weeks, they could still go and possible increase the contamination. I think they need to be very cautious in testing people a lot. Even though there are not that many cases, they need to be extremely vigilant and control any cases they have. They need to find a way immediately to plan for the worst scenario. So, for example, if I'm losing 2, 3, 4 doctors, how am I going to bring in other people to support me? Where am I going to get these people? And to try to help them to be as autonomous as possible. If need be, if one place needs this equipment, let's give them this. If we need more ambulances, just put the ambulances. And certainly one thing to consider is the helicopter system in the province of Quebec. We do not have a national helicopter system. It's time to think creatively in this matter as well.
Sounds like there's a lot of pieces that are missing.
Yes, but let's just say that at this point, we need to know that actually it is an opportunity to improve rural healthcare, and already we were already advocating for better healthcare, and right now it is the time to remove the bureaucracy, invest in rural health, and so that we can continue to enjoy these places safely as we did the whole summer.
Yesterday, we were hearing from Sylvain Roy, their MNA over in the Gaspé, saying that the situation, at least where he is, that was in the MRC d'Avignon and the Gaspé, that the situation was critical. If I'm not mistaken, roughly 1 bed for every 536 patients, or at least residents in the area, saying that situation has been well known. On the one hand, we've got the government telling Quebecers to spend their holidays in this province, to spend their tourist dollars. On the other hand, you've got people in rural communities saying, we need help. We needed help before COVID. How do you see that message of perhaps some areas not receiving the same amount of help and then potentially becoming a source of contamination, or at least being told that, you need to be open to the rest of the province? I'm kind of feeling like there might be some frustration there when it comes to people in rural areas, to doctors in rural areas who see that message from the province.
You're right. So, I mean, there is huge advocacy from local business leaders and the tourism agency. Of course, we need to support these agencies. So there's lots of publicity to bring tourists, and we need to contribute carefully. But right now, as we speak, the situation is critical. Okay, so the cases are increasing beyond what we expected, I think. And because many of these regions are close to red zones, or many of the tourists come from red zones, they need to be even more cautious. So I would say, I would say to the business leaders at this point, please, and to the public health officers as well, please put your ear to the ground to listen to your local healthcare professionals, because if you've seen one rural hospital, you've only seen one rural hospital. They're all different, and we may not know the level of capacity you have. So we need to pay attention and ask them, and enjoy that you've enjoyed a great summer. It's probably time now to start taking a step back, not bringing that many people in the resources in the area, and please give a rest to your resources now.
Dr. Richard Fleet, thank you for your insight this afternoon. We appreciate it.
Thank you very much. I appreciate it.
Richard Fleet is an emergency room physician. He's also a professor and research chair of emergency medicine at l'Université Laval in Quebec City. He joined us on the line from Lévis.